another episode of Bro Doc Talk. I'm always so excited to do this. We're always so excited to do this. Today we have two physicians here to speak with you about their journey, and I'm really excited to hear all about, what they have to tell us today. I am Henry Lewis III. I am a residency program coordinator and a former pre-health advisor. Dr. Young.
Thanks, Henry. I am Omar Young. I am a maternal-fetal medicine specialist, and I have the privilege of having two of my maternal-fetal medicine fellows here on the podcast today, Dr. Tanisha Wilson, Dr. Mara Jones, and I will let them introduce themselves.
I can start. I'm Tanisha. I am from Miami, Florida, originally. I went to the University of Florida for 12 years. I did undergrad, graduate school, and medical school there, and then went to Johns Hopkins for residency in obstetrics and gynecology. And now I have the privilege to be at UNC with the good Dr. Young for fellowship.
I'm Mara Jones. I am originally from Monroe, Louisiana. I went to Xavier University of Louisiana for undergrad. And then I went to med school at LSU in New Orleans. And then I did my residency in OBGYN at UCSF. And now I'm also here at UNC as a first year on medicine fellow with Dr. Young and Dr. Wilson.
And now we're going to be second years.
Well, yeah. And now we're
Yes.
We have graduated second year. Yes.
Congratulations.
Thank you.
So Dr. and Wilson, can you tell us, why did you choose OB and what was that journey to getting into OBGYN?
For me, I really loved surgery, but I also loved medicine. And really in all of my rotations, there wasn't a rotation or a specialty that, in my experience, that advocacy was a big part of the job. And that was what really drew me. And then being able to take care of women, especially women of color, understanding the mortality and morbidity disparity that persists in this country despite some efforts. And so I wanted to be involved in that specialty and taking care of all women, but especially women of color.
Yeah, I think similarly for me as well. I actually went to med school thinking I was going to be an anesthesiologist. And then I quickly realized that I just really enjoy talking to people. And so I think that I really got drawn to OBGYN because the doctor-patient relationship is just so intimate, and we really are there for our patients' best and worst moments of their lives. And so we get to be there through the highs and the lows. And I didn't really want to give anything up except for men. That was fine. But, it's a very broad specialty. You get to do surgery, primary care, cancer, infectious disease. And so and then similarly to Tanisha, I really was drawn to the advocacy portion. I was very involved in a lot of advocacy work, particularly related to reproductive rights and abortion rights as a med student, as an undergrad. And so OBGYN felt like a natural fit to be able to combine my love for advocacy work, as well as my love for medicine. And I think, she hit on all the high points in terms of our disparity in this country. Like I myself, I was born preterm to a Black woman in one of the parts of Louisiana that has the highest infant mortality rate in the country. And so I think that I have firsthand witnessed the way these disparities impact Black women and my mother specifically. And so I think that was kind of like my motivating factor for doing OBGYN, but specifically maternal-fetal medicine.
Mm-hmm.
You both mentioned advocacy, so we would be remiss in saying that we're recording this podcast a little bit after the first anniversary of the Dobbs decision. I know that how Dobbs has impacted my practice, and all of you know full well what I do advocacy work for that. But can you talk to our listeners about what does advocacy work in the realm of medicine or OBGYN mean, and how can you get involved in that?
Yeah. I think, there are many different ways to get involved in advocacy work. For me, one of the main ways was through ACOG. So I was the ACOG Junior Fellow Chair for California. I'm in my past year right now. And so I think through ACOG, I had the opportunity to go to a bunch of congressional leadership conferences, a lot of lobby days, really learned about the legislative process. But I think advocacy can start even at the hospital level, at the
Yes.
level. I think my residency program was very big on advocacy, and I thought a lot of my co-residents, like once I was the admin chief, were very annoying because they were always advocating, but like that's what our program selects for. And I think that like advocacy can be just like standing up for that patient who is like getting a detox unfairly or like being discriminated against in the hospital or having the police call on them while they're in labor or being handcuffed in labor. There are many different ways that you can advocate at the level of your hospital. My chief year, like one of my co-residents, like started a whole movement to divest the sheriff's office from our county hospital, like called DPH Must Divest. And so I think there are many ways you can advocate, even as a physician in the hospital for your patients. But I think on a bigger level, in terms of like the Dobbs decision and abortion advocacy, really there's going to be powers in numbers. And if we can't get behind, our organizations and get our organizations to stand up for abortion rights, no other physicians are going to do the same. And so a lot of that work right now is happening, through ACOG. Obviously, Dr. Young has done some work speaking to the second gentleman recently about how it has impacted our jobs. My co-fellow and I, Nicole Teal, went out to support the governor at a rally last month where we stood with him and you, Dr. Young, as the abortion legislation. So there are many different ways to get involved beyond just like the big organizations, but also at the hospital level. But I think it's now more than ever, it's very critical that we speak out because we're on a very slippery slope and things are only going to continue to become more and more restrictive. This is just the beginning of a very large plan to completely limit access to care.
Yeah, I completely agree. I think, every day we have the opportunity to advocate. I was on service last month and we had a patient who was pre-viable, who needed procedures that were involved radiation, and the radiologist refused, said it was the policy not to do this for pregnant women. And so I had to spend a long time on the phone educating that provider. And in doing so, we were able to get the patient the procedure. But, it's at the hospital level. Also, I think, we have this podcast, which is great. I think using social media as a tool is very, very important, especially since you have so many people out there that are using social media that don't actually have the correct information. We have a platform and we have the education, and we can use that platform to educate and put good information out there, as opposed to what some of the stuff that's being distributed is out there now.
I want to pivot a little bit to kind of your journey into medicine. That's the part that I'm always super excited to hear about. Tell us a little bit about mentorship. Who was involved in getting you to the point that you're at today? Tell us a little bit about that experience, Dr. Wilson.
Oh, sure. Oh my gosh, mentorship at every stage. I guess I can't really start without talking about my parents, without having strong mentorship in my parents, especially my mother, who is my biggest advocate and my biggest supporter. She has just been there throughout my entire life and is the reason I'm the woman I am today, for sure. But in terms of like professional, I think it's so important to find people that will support you. So, for example, when I was in graduate school, I had a PI that wasn't the best experience, but I had to find someone inside the graduate school that would support me through that process. And then in medical school, I had my DEI director, Dr. Parker, who was like a mother to me, but also directed me to different, experiences and opportunities that I wouldn't have been able to experience if I didn't have her. And then in residency, the same. It's just there's always at least one person, and you need to find at least one person that will be there for you, that understands what your goals are, that will support those goals. And, there's mentorship and then there's sponsorship. I think, mentors are people who, may be doing, for example, the same specialty as you, but they're sponsors who will, not necessarily are in the same specialty, but they are invested in your future and will do whatever it takes, literally whatever it takes to propel you to that. And so I think it's important to be able to identify at least one person throughout your career, like at each stage, to help you.
Dr. Jones?
Yeah, I think I came into medicine because my mom's a nurse. And, kind of growing up, she was a single mom. She had 3 kids, and we often spent a lot of our time. She worked in the nursing homes as like an LPN, and then we spent a lot of our time in the nursing homes, like when she could find a sitter, just kind of like playing puzzles with the people that were residents there. And so I grew up a lot, like in nursing homes as a child. And so just kind of seeing her like at work all the time and like how hard she worked to provide for us and like how she interacted with the patients and how they really liked her, I really wanted to have like a similar impact on others. And so that kind of drew me into medicine. I think I completely agree with what Tanisha said about mentorship and sponsorship. Like you will have people who are going to be there to kind of help show you how to get where you want to go, and then people who are going to like say your names in important rooms and kind of get you a seat at the table. I do think what I would add is that there's no one person who can be your mentor for everything. And so what I found over the years is that I have like a mentor who's like my life mentor, like my like work-life balance mentor. Like how do I achieve like the work-life balance that I want, the family that I want? My mentor who's like more of like career focused, like how do I get to this path of like leadership that I desire? My mentor for like, research. So, you have different mentors who will serve, different roles in your life and be able to guide you on different things. There's like not always one person who can kind of get you, to all the places that you need to go in your life. And I think the combination of a good kind of what I call like brain trust or team of mentors is really what's going to set you up for success. And I would just add that I think that like sometimes your mentors are peers. I think one of my biggest mentors and one of my biggest advocates has been one of my co-fellows who's now graduating, who literally like set me for success when I came to work with her as a 4th-year medical student, and made sure that I like, was shine in front of like all the people that I need to shine in front of to match that program, and like put me like in the same room, or made sure I was signing out to the program director so that I could look good and like they would remember me and they would rank me to match. So I think that like, there's like peer mentors and people who are like, farther along in their careers, 5 years out, 10 years out, 20 years out, like Tanisha alluded to, who are going to be able to help kind of guide you along the way and give you kind of like the short-term advice, but also that long-term like end goal advice.
And the other thing too about mentorship that I think that we don't focus on is the fact that it goes both ways, right? So you have mentors that will help you, but you also help your mentor when you're successful. And so I think thinking about that and always remembering that mentor or those mentors, that collection of people, that community of people that have helped you, and always reaching back to those and remembering them.
What would you say to those students or residents of color who may be at predominantly white institutions, who may not have access to proper mentorship or sponsorship, or maybe in situations where, they're not necessarily set up for success? Mm-hmm. Talk to me about how would you navigate those waters, especially as being a Black woman in medicine?
Well, I was in that situation at University of Florida. I mean, it was predominantly white. We did have a DEI office, and I was in that office every day of medical school. And thankfully, I mean, in that situation, we did have somebody that was there to support us and had the support of the institution to support us. In situations where that is not the case, I think now, like I alluded to earlier, with social media, you can find lots of residents, fellows at every stage, attendings, that are willing to serve as mentors. I think both Mara and I do that with our social media, and so I think social media can be a good thing, a very good thing. It has its negatives as well, but we can use that as a way to interact with people that you wouldn't otherwise have the opportunity to.
Yeah, I agree. I feel like social media has really blown up, and there's so many like women of color who are very visible on social media, who, read personal statements, like offer interview sessions, like want to mentor, have mentorship programs. And so I think that that's made it way more accessible. There's just way more, since there's more mentors than there ever were before on social media now. I think similarly to Tanisha, I also went to a predominantly white institution for medical school. So I spent a lot of time in our DEI office. We had a great, DEI vice dean who was able to kind of help guide us. But I think one of my biggest kind of like advocates, mentors was someone who was a white male who was in emergency medicine curriculum, like completely outside of what I even wanted to do. And so sometimes you have to just go outside of where you think, like OBGYN, for example, go outside of your specialty or your area. You'll find someone who, has similar values to you and is willing to promote you and mentor you, and really can help push your career forward, even if they're not in your field.
That is so true. One of my biggest mentors was a white male. And when I was having my struggles during my PhD, he actually took me on and helped me get a grant and funded I got a T32 grant through him. So, sometimes what we're looking for is not necessarily what we need. And it's important to realize that and understand when you do have something that is helpful or someone that is helpful, and accept that help, even if it's not what you anticipated.
Absolutely. Let's learn a little bit more about some of the obstacles you face. You touched on it a little bit when you talked about some of the things you learned from your mentorship, but obviously getting to this point that you're at today was not easy. How was navigating the medical education journey, just as a student in general, but also as a Black woman? Dr. Jones?
Yeah, I mean, I think that, I'm from Louisiana, and so I went to med school in a predominantly white institution. And so I think that to be successful in medical school, like evaluations are very subjective. And so that impacts like how you present yourself. And I think a lot of the rotation clerkship grades are very subjective as to how people perceive you. And so I think that I, did well because I gained a lot of confidence in my identity as a Black woman, actually from going to to an HBCU. That's really where I feel like I grew into my identity as a leader, as a Black woman, and became very comfortable with who I am and very empowered in who I am. And so I think that allowed me to really do well on clerkships. But I do think that medical schools kind of select for like the hardworking, kind of outgoing, bubbly type of people. And so I think a lot of people of color, a lot of Black students do more poorly on clerkships because, people are being typical and kind of racist in their evaluations, may not be explicit, maybe implicit, but in how they perceive Black students. So I think there's a lot that has to go into like making sure, that you're being perceived in a way that's favorable, which is not fair at all. I think there's a lot of work being done in the medical education space now to really make sure that our evaluations are subjective. But I think that's a general obstacle that a lot of Black students face when they're in medicine, like being true to who you are and your identity versus like trying to meet what people expect how you present as a Black person in medicine. I think that's a constant struggle, even once you're beyond medical school and into attendinghood.
Oh yeah, we've all heard of the code switching, right? We have to act a certain way. And even, what I realize is even your colleagues who may be of a different color can say a certain thing or act a certain way, and it's perceived a different way. And you as a person of color can't say those things. And like Mara's saying, it's not fair. Unfortunately, that's how it is. And that's how we've been conditioned, and we condition ourselves in order to be successful. I think the other obstacle that I experienced specifically in residency is now as a doctor, how I am perceived in comparison to how my white male counterparts are perceived, especially if I was like a chief and I had a junior male counterpart. I realized that the nurses were more willing to accept orders from the white male than from me. And it's a problem that I know I'm not the only one that has faced this. We've talked about it throughout my residency career, and I'm sure Mara has probably had a similar experience. But I think, it's unfortunate, but and frustrating, but it's something that we have to live through.
Yep, I had the exact same experience when I was a chief, and my intern was a white male, and they would go to him for consultation on patients on the GYN service. Not ideal. And going back to what Mara said, it doesn't stop when you are done with training. It absolutely probably manifests even more as an attending, because you are now in a position of quote unquote authority. And for whatever reason, those that you may have to work with may not accept that you are in that position. But I think showing up in those spaces authentically the way that you are is going to be the ultimate way to break those barriers, and then goes towards, having trainees in those spaces who may not necessarily have ever seen anyone that looks like them, has had their shared experience, that they now have someone to identify with and can actually succeed as opposed to being stifled.
Mm-hmm.
Yeah, I totally agree. And such what Kanisha said about like co-residents acting a similar way. And then I feel like as a resident, like I wasn't allowed to be frustrated or like show frustration or anger. Like it would just always come off bad. But
Yeah.
like my counterparts were able to be frustrated and angry and no one said anything about it. But like if I'm frustrated or angry, I have an attitude or I'm upset or, and so I think a lot of like having to like police your own emotions and your own behaviors is just very exhausting. And you just feel like you really can't be your true, authentic self.
Mm-hmm. Yeah.
Not a great way to go about your day when you're spending most of your day at the hospital.
Right. And Tanisha, you basically implied that the standard is a white male in medicine, which is highly problematic, right? And so everything that we do in medical education these days is to dismantle that construction, because that was exactly how, people were compared to for the last 100 years since the Flexner report. But I think it's important for those of us that are in medical education or aspire to be in medical education to realize what exactly the experiences that we've had that have contributed to the biases that we've sustained, and how to check those biases when we see someone experiencing that or we experience that ourselves. And so I think that's super important for us to realize when we actually go into the hospital that, we aren't just representing ourselves, but we're actually representing someone else. Now, so you could argue that's like a minority tax. But unfortunately, that's what you have to deal with.
Absolutely. I mean, we have to stop perpetuating it. And unfortunately, there are a few of us that have a lot of work to do. But it's a responsibility that we have, and we just have to serve as the example. And thankfully, we are in roles now, like Dr. Young and Dr. Lewis. You're in a role. You guys are in high roles where you're teaching residents, and that's important. It's why it's important for us to help bring future doctors of color into the field, so that we can kind of change what has been to what should be.
Mm-hmm. Dr. Wilson, I want to go back to a point that you made just a couple minutes ago about code switching, because that is something that obviously I think that, most of us have to experience in the work setting. How has that played out for you? Because, for example, I can think of a time where I had to do that when I was in graduate school. I was the only Black male in my class and one of two Black students in the entire class, no Black faculty. And yes, I found myself code switching often, and I felt like it played out as my professor came up to me one day and said, I had to do some type of evaluation with him, and he said, "You often come off as too polite." And that was the first time I had really thought about code switching. I probably had done it several times before, but I didn't really think about it until that moment. And he said that I come off as too polite, and I couldn't understand, it's like, is he trying to see through me? Like, what, what is going on in this situation? How has that played out for you all?
Yeah, I think for me, what people see when I'm in at work is a very professional person.
Hmm.
And that is because that is my way of protecting myself, right? By being maybe overly professional so that it I don't come across as abrasive or, have an attitude or um, just I'm accepted more if I have this professional persona.
Hmm.
And it's I get I sometimes I might not be friends with everybody at work, and I accept that because it's important for me to establish myself as a professional.
Right.
Um, some people, don't have to do that, right? And they're accepted without doing that. But it what I realize is it's contributed to my success, and so I've continued to do it.
Hmm. So,
Yeah, I completely agree with Tanisha on that point. I think she's exactly right. You have to establish yourself as a professional because we don't often get the benefit of the doubt of being assumed to be a professional. So I think that
Right.
she's spot on with that. I think that, obviously when I talk to Black patients, I talk to them in a very different way than I talk to, my peers. And that's just because culturally it's just different. And I think that's really what helps to kind of like bridge the gap between me and patients. And I think that they really like that. And I think that that's why we have such good relationships. And I think Tanisha probably does the same thing. But I agree when you're talking to your peers and others, it is important to kind of maintain professionalism.
I'm just going to push back a little bit. What is professionalism?
mm,
Mm.
Who's defining
Yeah.
right,
professionalism?
right.
And why do we have to or do not have to conform to someone else's definition of what is professional? Because I think that's an academic trap.
Yeah.
Because you're always told that you have to act and comport in a certain professional manner. But inevitably, all evaluations that I have seen throughout the years for trainees of color, unprofessionalism is always one of the words that's always highlighted for me in my mind when written comments.
What
So
is
I,
that?
I always go, exactly. So I always go back to the idea like, who is defining this professionalism?
Mhm.
I don't know if anyone has any thoughts on that.
It's a good question. It's a good point, Dr. Young. I think for me, it's not necessarily laughing at a joke that somebody makes that somebody else could laugh at, right? Because if somebody walks past and the Black doctor is laughing and not coming across as doing their work or being, because we already have there's this undertone that Black people are lazy, right? Or are here because of a quota, or we've all heard all of the things, right? And so it's not what is reality, but it's the perception, unfortunately. And maybe it's my perception of the perception, right? But because of that, I think because we all know that that is true, for me, I always have a heightened awareness of how I'm acting in certain environments and how that could be perceived. And that might be a good thing, it might be a bad thing, but I it's how I feel and it's how it's been for me.
Yeah, I mean, I think your point is well taken. Like professionalism is a white standard, and so I think that the way that I think about professionalism is really like more so how you respond to situations. And I always compliment Tanisha on this. And I'm like, you respond to all these situations so like mature and composed and how you communicate with others. And so to me, that's more so what I mean, like how you interact with other people, is what I think about, less so like the words that you're saying, but just like how like, what your response is, like what emotions you show, like how you display frustration or anger. That's more so like what I've been kind of like conditioned, I guess, to think about with professionalism. I think I went to a residency program that had a ton of Black residents, and so we largely just communicated, to each other in the workroom in front of our attendings. And the way I talk to all my friends, like just in like a hey girl, that's just kind of how I talk to a lot of people. Even now in fellowship, I'm maybe a little too casual, but I think that when I think about professionals, and I really think about your response and like how you handle conflict and how you handle situations. And I think that is really where like we truly meet our downfall, as how we're judged by others, especially as Black people. And so that's just what I think about a lot. Like, how can I handle the situation in a mature, kind of like calm way? Because I know that if I respond in an angry way or in a dismissive way or in any other way, it'll come off as like unprofessional or angry, or she has an attitude. And so that's really more so what I think about. I think less about like how someone presents themselves. But I think Tanisha raises a good point too, that you also can't be the one seen like always not working or seen not working, even if you are working just as hard as your co-residents or your colleagues. If you're seen not working one or two times, like people are going to remember that. They may not remember your co-resident doing that, but it's just the burden that we bear because the system is racist. So I mean, we're not going to fix it until there's more of us, in the system. And so I think now I'm just rambling, so I'm going to shut up. But yeah,
That's great. But you're right. We need that critical mass, to really
For sure.
culture. So
Yeah.
well said.
So Mara was saying about, composure. I think I've been in training for a long time. And I during my PhD, I could talk about obstacles. There's so many obstacles. But one of the things I learned was the importance of interpersonal skills and managing difficult personalities. And that
he's very good at
it. That is I agree with Mara, that is what I mean about professionalism as well. It's a matter of being able to hear what people say, even if you don't really agree with what they say, acknowledge their feelings and be able to express how you feel in a way that it can be received by them.
Well said. Well said. So what are some new projects that you're working on or looking to work on in the near future? Dr. Jones?
I don't like Dr. Wilson.
Yes, whoever would like to start.
Sure, I can start. So I think one of the things that I'm really interested in, so my graduate work was in basic science. I studied immunology, specifically lupus and mice and cells and translational science, very different than what I want to pursue right now, which is the overarching theme is patient education. I think if we educate our patients, we give them the opportunity to advocate for themselves. And so what I'm interested in right now is developing a group prenatal care, specifically for diabetes education. So diabetes group prenatal care, in order to educate our most vulnerable population, or which, a lot of our patients of color have diabetes. And I think what I've seen, especially since I've been in fellowship, is there is so much to be gained in patient education regarding diabetes, and not only for the patient, but also for the provider, and providers at every level. And so that's what I'll be focusing on over the next few months.
I love that. Thank you.
What
Yeah,
about
I think similarly, I am kind of also interested in patient education. And so right now what I'm working on is a patient education tool and like an aspirin self-screener. A lot of people don't know that aspirin is something that we give in pregnancy to prevent preeclampsia. And a lot of our patients across the board, across the country, are just like not screened very well. And preeclampsia is more prevalent in Black women. And so I think that if patients can screen themselves and really understand what their risk factors are for preeclampsia and why it's important to why we care about preeclampsia through education, then they will be empowered to talk to their providers about taking aspirin in pregnancy and probably have better uptake and compliance throughout their pregnancy versus the provider just telling them to take aspirin. They don't really understand why. So that's one thing I'm working on. And the other thing that I'm working on with a bunch of people at UNC is this trial called Cure for Moms, where basically we're working to see if doula care in combination with a data alerts dashboard that like gives practices kind of like a warning sign that patients have like missed visits or like at risk of falling out of care. If those two things together can help and improve low birth weight births among Black women. And so my work in that project will be specifically looking at like the way that patients in the different arms, because it's an RCT, the way they experience discrimination or racism in their care, like if doula care improves that or not.
I feel as if I'm very inadequate in my career compared to these two. So
Oh, Dr. Young.
no, that's great. As we close out this conversation, do either of you have any advice for our listeners who want to go into medicine or who are currently in training right now? I'll start with Dr. Jones.
Yeah, I think that my biggest advice would be just to run your own race. I think that one of the hardest things about medicine is that you're often comparing yourselves to other people at different parts of your career. It happens in undergrad, it happens in med school, it happens in residency. A lot of people will compare you to other people in residency, and it happens in fellowship and attending hood as well. And so I think the main thing that I've learned is that every person's journey is unique and we all deserve to be here and we all have different things to bring to the table that make us valuable in this space. And so it's just really important to stay focused on your why and your goals and kind of tune out the rest and really, really avoid comparing yourself to others, or else you will always feel inadequate and will always be unhappy.
I was going to say something very similar. You know, they get us confused in our fellowship program.
That's another story for another day.
Absolutely, absolutely, absolutely. Be your authentic self. I know it's hard. We were just talking about code switching, but in that, every stage, do some introspection. Just because you're on one path to begin with doesn't mean that you will end on that path. My path took me many places, and being able to be true to yourself and know what you want, right? And go after that. Just because you started at one place doesn't mean you have to end up at that place. Number two, I would say, which I think is so important, is from a very young age, learning how to strike that balance. And it's so hard, right? I think we in medicine are conditioned to focus on being very hardworking and to be very external. We're taking care of patients, and we pride ourselves on being sacrificial, which is important, but it's also important to take care of yourself first. You can't pour from an empty cup. And so it's important to find the things that you love and do those things too, outside of medicine, because that's what's going to keep you going. I think a lot of us feel burned out, and it's when I feel the most burned out is when I'm not doing the things that I love outside of medicine. So I think it's important to do the things that you love in addition to getting the training, because you know what, this training thing, it never ends. It never ends. And we have to sustain ourselves in a very healthy way.
Love that.
Dr. Wilson. And I love that you mentioned to, find it now, find it early. that balance and kind of what makes you happy and other things that you enjoy outside of medicine. Because I mean, just from my own experience, had I not, learned some of the self-care
Yes,
techniques that my dad taught me like years ago, I would not have made it through a lot of the things.
absolutely, absolutely. And
I
it's all about conditioning, right? So
Mhm.
if you're learning, for example, if you're in medical school and you're going through a tough time and all you're doing is studying, when you get to residency, you're not going to know how to take care of yourself because that's what you did in medical school. And when you become attending, you're not going to know how to take care of yourself because that's what you did in medical school and in residency. And we see it. We see it as fellows. We see it in attendings. We see it among our peers. And I think it's an important point because there are so many people in medicine that are, this is another conversation, but mental health in medicine is something that we need to be talking about, right? And I think it's because we don't learn from the early stages how to take care of ourselves. We learn how to take care of other people. But unless we can take care of ourselves, we can't take care of anybody else.
Yeah. And I think this really speaks to like a larger conversation that Tanisha and I have even been having amongst ourselves. Like people accomplish things and then they're just unhappy. They're just like never
Yes.
happy. And so it's like,
Yes.
what is it all for? Like
Right.
you just accomplishing things and getting accolades, but none of it is making you happy. And so like, why are you even bothering to do something that's going to make you even more unhappy? But it's just
Right.
like, yeah. And so I think, we were just talking about how it's just really important to find what makes you happy. And like, if medicine is just a job at the end of the day, then it's just a job and that's okay. And you can and you just can live your life and love what you love and find what you love, but then you also can go to work and love what you do at work, but there's balance and there is separation. But if medicine is your whole entire life and it's not going to make you happy, it's not fulfilling you, then like, what was it all for? And I think
100.
we get a lot too. People live their whole lives just like in medicine and then life, you're here one day, you're gone the next. And you just keep putting off the things that make you happy for your career or for medicine. But like, I don't know, I always think about when breath becomes air. I'm like, that man spent all that time in neurosurgery training and then he like didn't even get to live his life, you know?
Right. Yeah, I just remember when I was in residency, I had a mentor and she received a very important award. And I walked past her office and I wanted to congratulate her. And she was at her computer, working diligently. And, I said, congratulations. And she's like, girl, I can't think about that right now. I have another thing. We just have to move forward. It was just, there's another thing. Celebrate the wins.
Yes. Yes.
Please celebrate the wins because there's always going to be something else. There's always going to be something else to work toward. It's just how it is, but we have to stop and acknowledge that we've worked hard. And if there's something that we've been successful in, we need to take some time and appreciate that because there's work that went into that. Not only did we do the work, but we had people that poured into us, to help us become successful.
Amen.
That's great.
I'm
That's
taking
great.
you all's advice as well. I love that.
I mean, we're so future focused all the time in medicine that we don't really enjoy where we are right now.
Mm-hmm.
Oh, I never wanted to make medicine my life, so that's why I'm an outside activities person. So
Oh my God. Outside activities. Your life, okay?
Huh. We just like to take this opportunity to thank both of you for chatting with us today. This has been an awesome conversation and a very important conversation. Any final words, Henry?
Watch this episode to all the listeners. I mean, these are three amazing doctors who just gave some important gems that everyone can use really in any industry. So thank you so much, for all the education and therapy you just gave us in this episode. And
It's only because I've been getting therapy, also get
right.
there.
It helps. It helps. But yes, thank you very much. And to the listeners, stay tuned for another episode of Bro Doc Talk. Thank you.
Thank you for having us.